Good morning to our lovely listeners and viewers of Sun FM TV. Today, the Saturday on the 10th of May in the year 2025. Don't worry, I'm in a celebratory mood because I have to congratulate Mr. Keith Mwemba, who was elected as first president. But anyway, I'm not doing sports. Today, I'm doing health talk. I'm your host. My name is Lamek Zulu, professionally known as Four Legs. So today, we are discussing nursing care on Health Talk. And to help me understand what we are talking about, I have Mrs. Enedi Chabi, who is the Chief Nursing Officer and Head of Nursing Services at Ndola Teaching Hospital. Also joining us is Marjorie Piri, who is the Public Relations Officer at Ndola Teaching Hospital. So, Madam Chabi, good morning. How are you feeling today?
Good morning. Good morning, viewers. Good morning, listeners.
It's a wonderful Saturday, is it?
It's indeed a good Saturday. As a nurse, we are celebrating the Nurses Week. On Monday, it will be Nurses.
Hi, and good morning, Lamek Zulu, and good morning, viewers and listeners. We are glad to be here today. It's a Saturday. We are still celebrating Nurses Week, so I've accompanied the Chief Nursing Officer for Ndola Teaching Hospital.
Okay, nice one. So let's quickly get into this. I'll begin with you, Madam Chabi. Explain to us who a nurse is. If you want to white, then you jump in conclusion that I am a nurse.
So a nurse is a person who has completed a program of basic generalized nursing education and is also
elaborated. So
very important
week.
Okay, so as in Ndola Teaching Hospital, yesterday we had an exercise where we came up as management to help the nurses celebrate their week ahead of their Nurses Day, which breast cancers and these other cancers.
Okay,
Yeah.
so I'll get back to Madam Chavi. Give us a background. How did nursing start in terms of history? So who was behind this brilliant idea?
So nursing is ancient. Florence Nightingale, the founder of modern nursing, was born on 12th May 1820. She established a school that provided theory and basic nursing skills. There was war, so a lot where the wounded soldiers were and started providing care. However, she noticed that there were a lot of gaps to practice.
Okay, that's very touching. Now, I know that there's always a career path in any profession. Like in journalism, obviously, you have to have a diploma in journalism. You go to either Evelyn Horn or University of Zambia, and then you keep progressing. So give us a career path when it comes to nursing.
So currently in Zambia, we have the diploma in nursing, we have a degree in nursing, we have masters in nursing, and we are and they are supposed to be managers. And their training was for 3 years, and it's a diploma.
Oh, okay. Marjorie, in terms of enrollment, I know that schools have different calendars. As in Ndola Teaching Hospital, when it comes to nursing, are there any payments?
So we have both direct and in-service training.
Okay. Are there any payments?
Yes, there are payments. You pay about 8,500. I'm not mistaken. You pay about 8,500. I'm not mistaken. Yeah.
Okay. Yeah. Nursing is expensive. Okay. Okay. Now, nursing around the country, obviously, we'll be commemorating this day on International Nurses Day on Monday, like you mentioned. So, why do we celebrate this day, Madam Chan? Why this day as Ndola Teaching Hospital?
Okay, like towards this Nurses Week, as well as the commemoration that is falling on
just the language, the way they approach these patients. So what would be your message, especially that you're commemorating this very important day, to your fellow nurses?
We are regulated by Nursing and Midwifery Council. So there is a complaint charter. When someone raises a complaint, we have to investigate so that we come up with the truth. So at the hospital, we have a customer relation officer who goes the complaints.
Yes.
We meet, a team is constituted, we meet, then we hear from both the complainant and the nurse. Then a feedback is given. If it is found that there is negligence, the officer is charged.